Welcome back to this very special edition of Champion News Talk Radio, brought to you by championnews.net, your choice for the conservative voice. Our founder, Jack Roser, and myself today have healthcare expert, Obamacare expert, C. Stephen Tucker. And before the break, Jack, you were talking about your healthcare at your age, and you're going to need some help. And during the break, Steve, we were having this discussion for our listeners to hear. Let's continue where we were.
I think Jack is absolutely right, number one. Number two, if you know who had Barack Obama's ear before this was passed, one of his chief healthcare czars was Ezekiel Emanuel.
Jack being right that the elderly are going to be getting less
are in great
care.
peril.
Okay.
Yes, and then there's three reasons why. One, the man who had his ear, Barack Obama's ear, and one of his chief healthcare czars was Rahm Emanuel's brother, Dr. Ezekiel Emanuel. And he has published a study called The Complete Lives System. In the Complete Life System, you can pull this up in the Wall Street Journal, how Obamacare guts Medicare. And in it, it has a chart of Dr. Emanuel's bar graph of how much health care you should receive based on your value to the collective, to society.
To society.
Correct.
Yeah.
So you start down here, and you'll see this in the Wall Street Journal. You can pull it up anywhere, Google Complete Life System. Down here at age 0, you have very little value to the collective. So you should receive very little health care. As the bar graph continues to get up to about 35 years of age, this is when, according to Dr. Ezekiel Emanuel and other eugenists who believe in these kinds of things, that's how much health care you should get. Most of it in your lifetime is at age 35.
Because your earning capacity
you're a worker.
is more to pay more into their
correct.
system.
So you're good for the collective. As that bar graph starts going down, you get to around 45, which is where I'm at. I'm rapidly losing value to Barack Obama. Right here is where that starts dropping off. When you get to 65, 70, 75, or Jack's age of 88, you should receive as much health care over here as you should have received at the age of 0, because you're no longer value to the collective. That's the first thing.
But I just want to discuss this real quick. When you're in your 80s and 70s and those ages, that's when your health starts to become a little more problematic on a whole. I mean, that's normal.
Yeah.
It almost sounds like something that they were mocking Sarah Palin, those two words called death panels.
Yes, yes. And actually, we can't call it death panels now. We must call it a board. You see, there's a board that's being established called the Independent Payment Advisory Board. And it replaces MedPAC. For all intents and purposes. MedPAC was a bureau in the government, or a board, that would determine what kind of health care we should cut for Medicare. And then those recommendations for cutting Medicare would then be passed to Congress, and Congress would then decide, should we be this onerous in these cuts, or should we be a little bit more cautious and not cut so much? And it would have to pass Congress before MedPAC's decisions could be implemented. The reason they call the Independent Payment Advisory Board independent is because IPAB is independent of Congress. So these 15 bureaucrats that are appointed by Barack Obama himself, right, will be rationing care to the tune of $500 billion, cutting health care benefits across all streams of American healthcare system, not just Medicare. Here's the key point. If they cannot render a decision to cut benefits, it falls to one person to make those cuts. For the first time in U.S. history. Do you know who that is?
Zipperwick?
No, it is the acting director of HHS. Do we know who that is? Kathleen Sebelius, who, by the way, has been given unbelievable powers to continue to write laws and put forward mandates without Congress's approval. Since August 1st, 2011, she passed the new preventative care mandates, which sounds great to those who think that that's nice to care for people's preventative care. No copay, no deductible, no cost sharing to the person paying the premium. It's resulted in premium increases for my clients of 46%, but to the policyholder, it's free. The problem is that included in preventative care, Kathleen Sebelius believes that abortions are considered preventative care. So now, whether you like it or not, as of August 1st, 2012, your health insurance policy will be paying for 2 specific abortifacient morning after abortion pills, Ella and Plan B, which is why 400 Catholic bishops have risen up. All over Catholic organizations from the pulpit have saying, we will not comply with this legislation. But come 2014, it's not just abortifacient drugs. $1 of every health insurance premium will be going to an abortion fund for actual abortions. And what did the president promise? Stupid Stupak and the 13 Blue Dog Democrats in Michigan who said, well, we can't vote for this on moral reasons because it's going to fund abortions. And President Obama said, I'll sign an executive order. I promise you and the American people this will not cover abortions.
2 lies in less than
one radio show. Really, to examine exactly what's being proposed here is that the government is going to control the amount of money that goes into the medical services and the amount that goes out.
That's right.
Who gets it? They're going to have the flow. In other words, they can tax the hell out of us.
Yes, they can.
If they decide something is going to be practical.
Yeah.
And they also can stop the flow of the money out and tell you how much care you can get.
You're absolutely right, Jeff.
You know,
absolutely.
Also makes me think.
See how in none of this have they brought the monster of lawyers suing.
Yeah.
Now, what happens when the lawyers sue these people under this care thing?
Yeah. You know that there is no tort reform in Obamacare.
No, there's no tort reform.
And you know why?
So the lawyers are going to get rich at this thing.
Yes, sir. Yes, sir. And that's what Howard Dean told us. You know
By
that
design.
You know that radical right-wing Republican Howard Dean? You know him?
Not.
He told us, and I quote, there is no tort reform in Obamacare because we, quote, didn't want to piss off the trial lawyers.
Yeah.
That's a direct quote.
What's the name of this guy that had trouble with his wife and ran for president of the United States?
Edwards.
John Edwards, trial attorney, got rich off of suing doctors.
And doctors are performing far more tests than they need to do for fear of being sued.
Which is jacking up medical costs.
That's right. And we have OB-GYNs. We have a handful of OB-GYNs left
that
in
restricts the freedom of the doctor to give treatment that he may believe in or that's new, novel, maybe has some risk. After all, anything a doctor does, he's treating a person that's not fully okay.
That's right.
And treating that to get better or worse, there's always a certain amount of risk in that.
That's right.
And that shouldn't be decided by a bunch of trial attorneys that obviously have worked penalties into this thing that puts a lot of money in their pockets and does not a damn thing for the patients who are only necessary to create a lawsuit, is what they are.
Yep.
It's just a terrible process.
It's a terrible.
How long before we get to single payer?
You know, if you really want to find out about your disease, whatever you've got, from a sneeze to ears that don't work or whatever it is, the smart thing for anybody to do is go to Google.
Yeah.
Because Google has got a vast amount of information about everything that goes on, but your doctor can't go to Google and say, this new treatment that's been tried out down in the state of Maine is working pretty good. Do you want us to try that with you?
You can't.
No, he's going to get sued.
Now. You can't do that with IPAP. You can't do that. When you go to your doctor now, look what he does now. Does he write down your information in a paper file and put it in his drawer? All of them now have been forced to implement EMRs, electronic medical records. The reason they're doing this is so that data can be mined properly, so that what Dr. Berwick said, who was a former CMS director, so we can ration care properly. So your doctor will not be able to make those decisions.
Who thinks it's properly?
The statists who think everything should be their way.
You know what I find to even be more compelling in this discussion is someone that is on a different ideological standard. All their information is going to be there.
Oh, yeah.
And they're being looked at by this board.
That's correct.
What's to say, you know what, that person is really not valuable to our cause.
That's the biggest fear. And you know, this is not hyperbole. Look up the chief Medicare actuary study, Richard Foster, not a right-wing blogger. The chief Medicare actuary, as high as you can go in the government's Medicare department. He stated very clearly that Obamacare will cut, over the first 20 years, $4.95 trillion. Not the $560 billion they already robbed from the Medicare Trust Fund to fund the initial expansion of Medicaid, but $4.95 trillion. Worse is the fact that they will reduce the amount the government pays to doctors who take Medicare to less than what they reimburse doctors who take Medicaid today. Why is that bad? University of Virginia and the American Academy of Cardiology, 2005 study, surgical patients on Medicaid are 50% more likely to die than those with private health insurance. 4 years later, 2009, they're 97% more likely to die after surgery on Medicaid than private health insurance because they're not getting follow-up treatment. And this is before we put 25 million more people onto Medicaid. And this is exactly what's coming because of this decision that was rendered on Thursday morning.
You know, Steve, we are going to just can't wait to hear back from you when we come back after the break. This is compelling. Stay with us.